Good evening, Selamat Malam. Welcome to my no-name channel. My name is Bruce and this is another Bali COVID-19 update for June 20th, 2021. And so, not such good news this week. Let's get started with the numbers first. Okay, so let's take a look at the numbers. Bad news this week is the numbers in Bali increase and Java's looking especially bad with calls for a lockdown. I'll go into this in a minute after we take a look at just what the numbers are. New cases in Bali, 155, so we have shot up this week. That gives us a total of 48,239, 46,069 recovered, 1,533 deaths. And we are up 637 active cases, so this is not good news. The 155 new cases are all Indonesians, no foreigners. 128 of the 155 are local transmissions, 26 are from domestic travelers, and one case is from an international traveler. And the new cases were distributed as follows: Denpasar 54, Badung 22, Gianyar 20, Bali 6, Bulang 6, Tabanan 5, Jembrana 4, Klungkung 2, and Karangasem 0. And the total in Indonesia yesterday, 12,096. So, after all that good news, bad news. How serious is the situation? Well, let's take a look at this article. It was in Al Jazeera. It will get very bad. Experts warn on an Indonesia COVID surge. So health officials in Indonesia are blaming the emergence of the Delta variant for the massive surge in COVID-19 that's happened over the last few weeks, as the number of daily cases have tripled. But some of the country's leading experts are saying the reasons are not so clear. According to the health minister, Budi Sadikin, the spread of the virus variant is very fast. And he added that it came in through the ports, that Indonesia gets goods from its many seaports, and many come from India, and that's where we've gotten with the Delta variant. But experts say that the Delta variant is not the problem. They say that the surge is attributable to what we've been talking about, before the travel at the end of Ramadan, when many people ignored the ban on going home and did it anyway. And so they say that this is because of the ban, the absence of because of people ignoring the ban, the absence of cohesive policy, health policy, coupled with confused messaging and the privatization of testing regimes and ineffective tracing. So while travel was banned from April 22nd to May 24th, it's been estimated by the government that between 5 and 6 million people moved from city to city in the two most populated provinces of Indonesia, Java and Sumatra. Two most populated islands, Java and Sumatra, during the holiday period. And while, according to Gianyar University professor, that's our university here in Bali, Gusti Nura Mahardika, he said all the variants are a problem, but the Delta variant hasn't proven to be more deadly at this point. He said it only gets a silver medal. The champion in Indonesia is still the Alpha variant. I believe the Delta variant is being used as a scapegoat because of the government's incapacity to control the pandemic. And Mahardika said it's almost impossible to pinpoint the reason for the surge because infection rates are so underreported that health data cannot be referred to in Indonesia, but he pointed to a number of causes, a few of which I've mentioned, people traveling during Ramadan. But also, we're a disorganized country, he said. Most of the focus is on the economy, and people are experiencing COVID-19 exhaustion and fatigue. And I've talked about this before, and you can see this happening around the island. He said, in the capital of Bali, in Denpasar, where I live, the cafes and restaurants are full every evening. And if you're on the island, you've seen this, and we have this here, and this is something I've talked about in terms of schools. We have the schools closed, but the malls are open, the shopping centers are open, the restaurants are open, the bars are open, the gyms are open. And so this micro lockdown, this so-called micro lockdown, is proving to be very ineffective as far as that goes. Ahmad Utomo, who's a molecular biological consultant in Jakarta, said that he absolutely agrees with the Delta variant being used to obscure mismanagement of the pandemic. He said, whatever the variant is, needs human activity to replicate. Indonesia is doing a good job in genome tracing, which is how they know that the Delta variant is here. But he said the variant is like a sports car. It can go very fast, but even a sports car can only go as fast as the road you give it, and you have to address human mobility to slow it down. Okay, well, this was clear to a lot of people, but a lot of people disregarded the advice. Utomo said too many people are disobeying health protocols and travel bans, and the government's making it worse by failing to invest in testing and tracing. Dr. Diki Budiman, and I'm talking about him in an article coming up, an epidemiologist who helped formulate Indonesian Ministries of Health pandemic management strategy for the last 20 years, said that while the Delta variant is more infectious than the Alpha variant, it's the latter that's driving the current outbreak. Currently, the spread of the Delta variant is very small, and I talk about this soon. We have 104 cases reported so far, while the Alpha variant is being spread by community members who disobeyed the travel ban. I agree. Here's another one. I agree that the Delta variant is being used as a scapegoat. We are more than 1 year into the pandemic, but the government has proved it's incapable of controlling COVID-19. While the Alpha variant might still be dominant, Budiman warned that it's only a matter of time before the Delta strain takes over, and he fears that Indonesia could be facing an outbreak comparable to India's. The Delta variant, he said, will lead infections next month. I predict that in July there will be a huge caseload in the community and rising mortality in Java because 40% of Indonesia's population lives on the island, and this density puts them in a very dangerous situation. If you ask me how bad things are going to get, well, it will get very bad with much higher mortality because we can see from what happened in India that the pattern is very clear. The Delta variant impacts much harder in countries that do not have enough social distancing, mask wearing, testing, tracing, and vaccinations. Now, our vaccinations in Bali are continuing to go on, and I'm going to talk about that. And the government here has done a good job on vaccinating people, although there's been some strange numbers, and that's coming up next. It's been noted that the government has been anxious about the economy since the pandemic began last year, but it's worried about the economic situation because it can't provide Social Security, let alone enough food packages for its 270 million people. Approximately 10% of Indonesians live below the poverty line. However, Budiman warned that micro-lockdowns are proving to be ineffective. He said that they're still focusing too much on economic consequences, but sooner or later they're going to have to rethink their response because the experience from many other countries shows only total lockdowns combined with increased testing and tracing, followed by isolation and quarantine with massive vaccination programs, are effective at containing the Delta variant. So, even now, with our numbers going up both in Bali and in Indonesia as a whole, especially in Java, we're still talking about opening up in July. And so that's that's the number situation. And so let's take a look and see what's going on with the vaccines and vaccinations. So we have the numbers, and the numbers are trending up. Okay, not a good sign. How's the government going to deal with this? That's the first story. Anticipating new variants, Denpasar residents will be randomly tested for antigens in crowded places. So in order to optimize and improve the handling of COVID-19 in Denpasar and anticipate the spread of new variants of COVID-19, the Denpasar City COVID-19 Handling Task Force is going to conduct random rapid antigen tests at several crowded points, including Sanur Beach, Puputan Field, and other areas around Badung and Denpasar. According to the spokesman for the Denpasar City COVID-19 Task Force, Dewi Gede Rai, they're going to start tomorrow, well, according to this, so that was today, so they would be starting today. He said that this step was taken due to the increasing number of COVID-19 cases in other areas, and they don't want to get careless here. He said, and so we have explosions like in Kudus and in Java. And as is known, various places outside Bali, especially on the island of Java, which is, of course, our neighbor, cases have increased sharply and new variants have been found, including the Delta variant. And so they're going to be doing tests because we've had a little spike in cases, like in family clusters. Currently at the bed rate, the occupancy rate of beds has gone up. Currently at Wangaya Hospital at 17.3%, but it's increasing, and I've talked about this in another section here. So this is a way to try to keep hold of things, try to keep this from spinning out of control as our numbers start to go up. And remember, we had Idul Fitri, and I think you're seeing the results of this in Java, and we have people going back and forth, and you look at the numbers today, and we've got those numbers of domestic transmissions, domestic traveler transmissions. So, yeah, that's not good. Okay, so we see big numbers in Java, and back here at home, our numbers are going up. So, as usual, we're going to focus on the vaccines. And so what about the vaccines? Continuing to go on around the island, racing towards the 70% vaccination rate, and I'm going to talk about that a little later. First, COVID-19 Delta variant. Epidemiologist warns of possible explosion in cases. So an epidemiologist from Griffith University in Australia, Dickie Budiman, said the government should be aware of the Delta variant of COVID, which has already reached Indonesia. The Delta variant was called at one time the Indian variant because it was first reported in India. He said that this variant is a super strain, it's highly contagious, and can also increase the severity of symptoms and the effectiveness of vaccines. However, current studies suggest that Pfizer and AstraZeneca vaccines are not affected by the new variant, so their efficacy is good against the Delta variant. He said the Delta variant, which will likely trigger the explosion of cases in Indonesia, meets the criteria as a super strain. This is an epidemic threat in the midst of a pandemic. This is very serious, he said. And the government data shows that the variant entered Indonesia in May. And based on modeling a number of countries, he said that the new variant will explode 3 to 6 months after it's first discovered. And so where do we have this new variant? Well, there have been 104 cases so far reported in Indonesia in 5 provinces: South Sumatra, Jakarta, Central Java, Central Kalimantan, and East Kalimantan. So far, we don't have any cases reported in Bali. So Dickey suggested that the government needs to adjust its strategy for handling COVID-19 to suppress the explosion of cases. And he said that there's 3 different strategies that need to be carried out: conducting massive and aggressive testing, massive vaccination, and even lockdown, although the government is really not in favor of lockdown. He added that this is difficult for Indonesia, but we must really be prepared for it. Okay, so we've got the Delta variant, and that's what has people worried all over the world at this point. What about it? Well, next one. This is a little different. Patients infected by Delta variant in Indonesia show mild symptoms, according to another expert. So, a number of experts and studies show that the Delta variant is quickly transmissible, and patients infected with the variant develop worse symptoms than those with other variants. And the head of the Injected Institute for Molecular Biology, Amin Sobandrio, explained that the symptoms developed by patients with Delta in Indonesia are similar to those of other variants. He said there's no authentic reports of differences in symptoms in patients infected with the Delta. However, he confirmed that the Delta COVID-19 variant spreads faster. But, he said, many tested positive for the variant, but they developed mild symptoms. Now, this is in contradiction to other experts who are saying that the symptoms are more severe. The dean of the Faculty of Medicine of the University of Indonesia said that the Delta COVID variant is increasingly spreading in the archipelago. In the last 4 weeks, there's been a 51.4% hike in variant cases in Indonesia. And he added that the Delta variant causes patient symptoms to be more severe and increase the risk of hearing loss, heartburn, nausea, and having complications. COVID-19 patients with this variant need to be hospitalized and may need oxygen supplementation. So this is a little different than what the previous expert said. And of course, not everyone agrees on this. What's the consensus so far? It seems to be that the Delta variant spreads faster. Everybody agrees with that, and the symptoms are more severe. What about the next story? WHO warns of fresh Indonesian COVID-19 surge fed by virus variants. And so, Pak Jokowi, Indonesia's president, has ordered authorities to ramp up the country vaccination campaign as the World Health Organization warned of the need to increase social restrictions in the country amid a fresh surge of infections caused by worrisome variants. Pak Jokowi said we need vaccination acceleration in order to achieve communal immunity, which we hope can stop the COVID-19 spread. And so he wants to jump up vaccinations to 1 million a day. Currently, it's reported to be 500,000 a day, 500,000 people a day. The plan is that Indonesia is going to vaccinate 181 million of our 270 million people by March 2022. But so far, 11.8 million have been fully vaccinated, and partially vaccinated another 9.6. So the rest of the country is behind what's happening here. And a spokesman for the National COVID-19 Task Force said that the slow progress can be attributed to limited global vaccine supply, unpreparedness of the national health system, and vaccine hesitancy on the part of people. So far, the Indonesian government has received close to 100 million vaccine doses. And this week, yesterday, Indonesia reported, and I'm talking on Friday, Indonesia reported 12,624 new COVID-19 infections. This is the biggest increase since January 30th. And 277 fatalities were added to the death toll. And this increase in cases has been blamed on Eagle fig tree, as people predicted, as well as the arrival of new variants, such as the Delta variant. And number of hospital beds occupied in Jakarta have jumped up to 75% this week from 45% last week. The WHO, in its situation report on this, noted that Indonesia's drastic increase in bed occupancy rates is a major concern and necessitates the implementation of stricter public health and safety measures, including large-scale social restrictions, which I don't really think is going to happen. But we'll have to see how this pans out. Are we going to see an increasing number of cases, especially over the next month? So the spike has been seen all throughout Java, particularly in West Java, Central Java, Jogja, East Java. And since the pandemic began, there's been 1.9 million COVID cases in Indonesia, 53,700 deaths. This is the highest in Southeast Asia. And many people think that these numbers are actually an undercount. And so, what about here? What's been going on here? Well, there's been some interesting number questions on a number of social media sites who follow the reports from the government about how they're coming up with these percentages. So, next one, herd immunity claims from Bali's Gianyar Regency doesn't take into account region's entire population. This is a story in Coconuts and as well as in an Indonesian news source. Links below, as usual. So Bali's Gianyar Regency claimed that it achieved herd immunity with over 190,000 people vaccinated. And they're doing this based on numbers that are not the total population, it seems. And I'm going to show the actual populations based on the 2020 census. The actual numbers, Gianyar's population is 515,000. So if there's been 190,000 people vaccinated, I'm not sure how that's 70%. And that's what this article says, and a number of other people on the social media site, Jackie Pomeroy's social media site on Bali's COVID. And so the regional secretary, Gianyar's regional secretary, said, regardless, that Gianyar has reached herd immunity. And so it seems that they're discounting the vaccine eligible population of 380,000 people, but if you're talking about herd immunity, you have to have the total population into account. And so these numbers seem to be a little inflated. Gianyar's regent said that the region has been able to achieve such a speedy vaccinations through its Banjar system, and I've talked about that before. He said that with the Banjar system, it's the first in Bali that we're easily able to control giving second doses to the vaccine. And so we know that, and I've talked about this a lot over the last month, Bali has been really good, really aggressive about vaccinating people, and people have been very forthcoming. Nobody's been given free chickens here. I've lost the link to that, but in one of the villages in Java, I don't think I mentioned this last week, right? One of the villages, they were giving free live chickens away if you got vaccinated. I told my wife, she said, oh, I wish they did that here. So it's great, what's happening. And what about Badung? So 331,000 Badung residents have been injected with vaccines. So according to Badung, they've reached 85%. That achievement has exceeded the target for each district and city ahead of the opening of tourism. And so here they're saying the top population is 387,000. Well, you can see here that it's not on this chart. That is not 387,000. I don't have the numbers right in front of me right now, but it's up over 500,000. And the deputy regent of Badung explained that the government is currently trying to prevent the transmission of COVID-19 through the vaccination program, which we all know and appreciate. In addition, public education needs to be remain disciplined on health protocols routinely being carried out. And so that's just as important as the vaccination program. According to the Deputy Regent, we have to do vaccinations quickly and measurably. Thankfully, in Badung Regency, with continuous vaccination, positive cases of COVID-19 can be suppressed. Until yesterday, we were able to vaccinate as many as 331,327 people from our target of 387,000. But the target shouldn't be 387,000. This target exceeds the target given by the center of 278,000. I'm not sure who the center is there, if that's Denpasar or if the center is Jakarta. Furthermore, Suyasa said at the end of June, in the third week, his party targets 90% of Badung people to have been vaccinated. And so, once again, here's another situation where they're basing the percentage in order to reach this 70% herd immunity, which I'm going to talk about shortly, on the wrong numbers. And so the decreases in cases since the vaccination program started, he said, has been very significant. In the past, we used to have 115, but now there's at the most 22 people. And so we believe this vaccination is effective enough to increase community immunity, he said. With the decline in cases and the incessant vaccinations carried out in Badung Regency, his party, as the government, hopes that the confidence of both domestic and foreign tourists will continue to grow and tourism will revive, which we all hope. He said, currently there are 7,000 to 10,000 people who come to Bali by air, not to mention those by land. And so we have people coming in from other parts of the country, domestic tourists, as well as the foreigners who are coming in on the B211A, and I heard some people are coming in on B211B. So those people are continuing to roll in. And then we have the domestic tourists. If we have a surge in Java and we've got domestic tourists coming in, that could be a problem for us. Okay. So, any more on vaccines? Yes, lots and lots on vaccines. And more on vaccines. Hundreds of expats in Denpasar have now been vaccinated. So Bali officials have confirmed that over 500 foreign nationals who've been staying in Denpasar have received their COVID-19 vaccine. The spokesman for the Denpasar COVID-19 Handling Task Force, E. Dewa Gede Rise, said that 537 Kitas holders have been vaccinated in the Denpasar area. He said, according to our data, there are 537 expats who have been staying mostly in the Sanur area and have now received their first dose of the COVID-19 vaccine. And he also said that some of those have already received their second dose. And most of the expats who stay in Denpasar have been working in several different professions, such as teachers and tourism workers. And he went on and said that some of them even voluntarily went to hospitals like Wangaya, I don't know where Wangaya is, to get the vaccine. They didn't just go to the vaccination sites, they went right to the hospital. And the Wangaya Hospital reported that they've been distributing the COVID-19 vaccine to foreign nationals who came to the hospital by themselves to avoid getting COVID-19 during their stay in Bali. And the Denpasar city government has been communicating with some of the consulate generals of different countries, such as South Korea, Japan, and India, regarding COVID-19 vaccine distribution to their citizens in Bali. And according to Pakurai, every expat is required to get permission from their embassy before receiving the vaccine in Denpasar. Apart from that, we expect vaccinated tourists, vaccinated expats to promote that Bali will be a safe place to visit once international travel quarter reopens. Well, I don't know if the people down in the south are having to get permission from their consulate, but here they don't, or I didn't, and I don't know anybody else here that up in Bulaling that has. And next, Bali authorities will potentially sanction people who refuse the COVID-19 vaccine. This is an interesting story. Authorities from the Jembrana region will implement a reward and punishment policy while distributing the COVID-19 vaccine in their region. According to the Jembrana regent, E. Nenga Tamba, he's been disappointed at the response in some of the sub-districts with the vaccination distribution because the number is still far from the target. He said, from a total of 224,983 residents who were targeted to receive the COVID-19 vaccine in Jembrana, only 96,327 have received their first dose. So we've only reached about 42.82% of our target, and that's disappointing. During a meeting, Tamba urged his team to start implementing a reward and punishment policy to accelerate the COVID vaccine distribution in Jembrana. He said, we plan to implement different sanctions such as suspending people's wages, public administration services, and even suspending village cash assistance programs to people who refuse the vaccine. Tamba asked his team to find out the cause of their low achievement rate on the vaccination program. So with 37 days remaining until the target set by the Bali Provincial COVID-19 Task Force, which is end of July 31st, the regent wants everything to be maximized. He asked, is there low public awareness of the importance of vaccination, or is it the lack of socialization? This needs to be fixed now. And he said, our realization is still very small. I have urged the sub-district and village heads to come down to the community a lot, give them an understanding of what the vaccine is for, including the reward and punishment system if someone does not take the vaccine. It can be in the form of, as I said, delaying payment of fixed income to employees, delaying transfer of funds to villages where vaccination absorption is small, or delaying administrative services to people who refuse to get vaccinated. That's not good. I don't really like the reward and punishment system. But that's the first place I've heard this, in Jembrana. Everywhere else, the vaccination program seems to be going full bore. Okay, and so what about herd immunity? Okay, so I'm going to say something about herd immunity. So what about herd immunity? Well, with herd immunity, elusive vaccination best defense against COVID-19, Stanford epidemiologist says. Epidemiology expert Julie Parsonet warns that COVID-19 vaccine hesitancy has probably made herd immunity unattainable, which makes vaccination all the more important for personal health. Now, this article is focused on the United States, and I'm not trying to compare the United States and Indonesia, and I'm not going to go over all of the things in here. There's just a couple of salient points here that pertain to us, and so I'm just going to cover those. We need to stop pushing herd immunity to the public, Parsonet said, as it may discourage some people from getting vaccinated in the mistaken belief that if other people get vaccinated, they can just wait for herd immunity. Public health departments don't talk about herd immunity because it's not helpful for the immediate protection of individuals in the overall response to the pandemic. What's important is getting as many people vaccinated as possible. Okay. And nevertheless, the concept caught the public's attention last year as cases skyrocketed. Some have latched onto the idea thinking that once the population reaches a certain threshold, okay, we're going to say 70%, right, the coronavirus will dissipate. Now, the numbers about herd immunity have changed. At one point, early on in the pandemic, they were talking about 60%, then it went 70%. Now people are talking about 80%, 85%, 90%. Well, 70% here has been, okay, one is science changes as situations change, as results come in and tests are done. 70% has become a magic number, especially in Bali. And you see, when I was talking about the funny, wonky math that some people are doing here to get to 70% or 75% or 85% or 95% in some cases when people are talking about their regency. The 70%, it's the magic number. Once we hit 70%, we can open up, everything's cool, and there's not going to be a problem. That's not the reality, as far as scientists say. And so, the other important thing to remember is that herd immunity is not this aha moment where suddenly there's no more disease and we don't have to worry about it anymore. Parsonet said, it's something that must be maintained mostly through vaccinations once transmission has slowed down. The best way to handle this is to vaccinate people who are most likely to transmit the virus, young adults, people who have a lot of contacts, people who live with a lot of other people in their households, Parsonet said. If you want to approach this in a realistic way, the focus shouldn't be on herd immunity. It should be on vaccinating as many people as possible, especially the people who will have the biggest impact on the population level. That's what will make the biggest impact on significantly diminishing the rates of COVID-19. Okay, so why have I mentioned this? Because there's this belief at the governmental level, but also I think at the personal level, that once we hit 70%, everything is going to be cool, and life is going to go back to normal, and the virus is just going to disappear, and that doesn't seem likely to happen. Okay, so that's enough of that. Now, interesting article to read if you want to know more about herd immunity, and the link is down below. Okay, and it's time for the Naughty Foreigner section of the video. And, well, no new Naughty Foreigner activities this week. Nothing has gone viral that I've seen. Good news. But there is an article about what's happening with foreigners and stressed about not having a job in Bali. 78 foreigners deported throughout 2021. So this is so far. The Ministry of Law and Human Rights in Bali has deported 78 foreign nationals from Indonesia during 2021. They were deported for violating several provisions, such as regularities in residence permits, finishing serving a sentence in prison, and violation of health protocols. The head of the regional office explained that most of the foreigners who were deported came from Russia. Some of the Russians even went viral on social media, he said, and I've talked about that before. I'm not going to go through that. You all know what those things were about. So he said foreigners who misuse a residence permit often do so because they do not have enough money to meet the demands of living during their vacation in Bali, and they don't have a job, so that affects their psychological makeup. He said a lot of depression. Think if you're in a country and people don't have jobs, that causes depression, doesn't it? If a shipment, and this is a translation, I would say, if some cash from the family doesn't come in smoothly, if it does come in smoothly, it won't be a problem. But if it doesn't come in smoothly, people get depressed and they resort to other measures. Whoa, and wind has just come up here, and I don't know, things are blowing around my balcony. Okay, let's stop for a second. Okay, don't know what that was about. there's some rain over to the east, but I don't know, that sudden gust of wind, that was pretty weird. All right, so back to this. During the COVID-19 outbreak, it was explained that the Ministry of Law and Human Rights would continue to carry out patrols to prevent foreigners from violating laws in Bali, and they will continue to cooperate with several related institutions in Bali, such as Satpol and the police. And so, I've talked about this before, foreigners are being deported, and so, yeah, watch your step. Okay, so what's going on the island besides the direct impact of the virus? Bali police confirmed that the crime rate has significantly increased since the pandemic struck. The Denpasar Police Departments confirmed that the crime rate in Denpasar has increased significantly since the pandemic started last year. The head of the Denpasar Police Department confirmed that the Denpasar police officers have arrested 27 suspects in 27 different cases within the last month. He said 27 suspects were arrested from our officers from the 10th of May to the 12th of June, and that was twice as many compared to previous months. So crime is continuing to get worse, unfortunately. During the month-long police operations, the officers have seized a large amount of evidence from the 27 cases, and this includes laptops, motorcycles, 17 units of motorcycles, a cow, a pickup truck, notebooks, hammers, screwdrivers, knives, handcuffs, grinders, bags, gold necklaces, and cash amounting to 14 million rupiah and more. And he's admitted that the situation has become much worse since the pandemic struck, causing many people to lose jobs and resort to crime to get an income. He said that the public should be assured that the police department will optimize their operations to reduce the crime rates in Denpasar city. He added, I want to remind people to be more alert and careful, especially during these tough times in Bali when people tend to do bad things in order to survive. Are we going to open or not? This is June 20th. And July is 10 days away, 11 days away. So what's going on? Well, Pak Sandiaga Uno, our friend, the Minister of Tourism and Creative Economy, says Bali is ready to welcome tourists with 70% vaccinations done. Okay, more numbers, right? Where is the 70% coming from? We don't have 70%. I would like to see the numbers that show that we have 70% throughout Bali. Okay, so what are the reasons for opening up? Why? He says we're ready to go, right? We're ready to welcome tourists. What are his reasons? So let's take a look. Vaccinations have reached 70%. The tourism industry has prepared CHSE certificates to guarantee tourists for the implementation of health, hygiene, safety, and environmental sustainability. Okay, and that's true. We have lots of hotels. Supposedly, there's going to be 1,200 by July. The Work from Bali program is going to be the first step in helping tourism sector recover. Okay, that's being planned, although there was an article, which I don't have time to go into today, questioning whether, with the spike in cases in Java, whether we should be bringing people in from Java. There's already 3 designated COVID-19 free green zones, which provide a sense of security and comfort for visiting tourists. Okay, so I don't know. Is that going to make people feel better? Could be. I hope so. Pak Uno is working on the travel corridor arrangement policy, and it's supposedly in its final stages. Which governments have said okay? Nobody knows. Have not gotten there yet. So we were in the final stages a couple weeks ago. We're still in the final stages. And Pak Sandiaga Uno continues to coordinate with relevant ministries and institutions, especially the Ministry of Foreign Affairs, Ministry of Law and Human Rights, Ministry of Health, COVID-19 task force and the Bali provincial government so that TCA can run on time. And in addition to, next one, in addition to CHE certification, there's readiness of the regional government in providing facilities such as referral hospitals for information about COVID-19 in Bali. And that's true. We have a number of hospitals here, and we've got all over the tourist area. Even here, up here, we've got Bali Med, we've got the government hospital, we have a couple of other private hospitals. We have Kurtu Osada, not far from me. And Bali continues carrying out the vaccination program, especially for the 3 green zones, which he said are almost at 100%. Okay, questionable. And it is hoped that it will create herd immunity in Bali. And then this one, which I hadn't heard about before, another facility presented is the construction of a special COVID-19 laboratory that's been globally certified in Bali. The presence of this special COVID-19 laboratory is a support for international standard health infrastructure that will stimulate Bali tourism. The laboratory is specially designed as a lab that focuses on PCR swab test, antigen swab tests, serology tests, and other tests related to COVID-19 so that the results are fast and accurate. Okay, so these are the reasons why Pak Uno says we're ready to open. Are we going to open on July 1st? Are we going to open on July 15th? Are we going to open on July 31st? I'll get to that when we get to the wrap-up. Okay, on to opening, still more opening. Bali asked to really pay attention to open border risk. While everyone's anxiously waiting for Bali to open up to international tourism, one expert, Ikatut Swarjana, cautioned that all factors need to be considered, not just the economy. He argues that foreign tourists, as they come in, are likely to bring in the virus with them, including the new variants. And he's calling for a cost-benefit analysis. What are the negatives? What are the positives if we open up right now? He said if Bali is to open, he suggested all entrances to Bali be tightened up. This includes negative COVID-19 PCR results, a strict quarantine with costs paid by visitors, health insurance, and strict sanctions if the foreigners violate health protocols. Furthermore, he suggests a government plan to purchase additional vaccines such as Pfizer and Moderna. Okay, that's it for today, this week. A lot of stuff, a lot of news stories came out today that I didn't cover because I just didn't have time. You'll notice that there's, this is heavy, as it has been for the last few weeks, on vaccines, vaccinations, and today numbers and predictions about what's coming up in the next month. A lot of articles there about the Delta variant and the WHO and experts talking about how bad the Delta variant is, about the Alpha variant, warnings about what's going to happen, a big surge in the next month. Why am I stressing that today? Because that affects us directly here in Bali. Bali is part of Indonesia. Sometimes foreigners forget that when they come here. This is not a country, it's an island in a country. And we get, if you listen to carefully, a little part of what I was saying before, we're getting 7,000 or so people coming in a day, domestic tourists, travelers, workers. Where are they coming in? A lot of them coming in from Java. Where is the big surge? In Java. So that's going to affect us. Are we going to open on the 1st, the 15th, the 31st of July? Are we going to wait until August, September? Unclear. It's like with the proposal to lengthen the quarantine to 14 days. Okay, that was back in June 4th, so a couple of weeks ago. An announcement was forthcoming. There has been no official announcement since then. So they're still mulling that over, I guess. And the original plan was when foreigners came in here, they were going to have to be vaccinated. Then it just suddenly changed, and it was vaccinated and unvaccinated people. So nothing is for certain yet. When people say it's going to open, I've got tickets. That doesn't mean anything. The airlines can do what they want to. It depends on what they're deciding in Jakarta, and that's what we're going to have to wait on. And what kind of pressure the government in Bali can put on them if it really wants to open. So, yeah, as I say every week, I don't know. I don't have a crystal ball. I can't tell. Depressing numbers today all over the country, really depressing numbers in Java, depressing numbers in Bali. This isn't good, depressing numbers in a lot of places worldwide. We're getting spikes in a lot of places. And the Delta variant, whether that's going to be worse than the Alpha variant or not worse, don't know about that. The opinions are decided, as you see, if you listen to each one of those sections where I'm talking about. Everybody agrees it goes faster. Whether it's more severe or not is unclear. So we're just going to have to wait. In the meantime, the economy is not good. Crime rate is starting to go up. That's not good either. So we're not in the best of situations today. So if you happen to watch some sunny influencers talking about move to Bali, it's a great place. It is a great place. Should you move to Bali right now? I'd wait and see what's going to happen. I saw on a social media thing yesterday, people talking about this is great, so a visa is a couple $100 to get the business visa and come in here. Big deal. I'm coming anyway. If you're going to come here on the B211A or B, make sure you're coming here to go with a plan because we're in a bad situation here. Let's be honest about it. There's no sunniness today, unfortunately. The economy is tanked. People are suffering. Businesses are closing. People are having a hard time finding jobs. We're seeing more and more Balinese and Indonesians, non-Balinese Indonesians on social media, on foreign social media sites, Facebook sites, advertising themselves, looking for work. That's been increasing recently. So if you're going to come, wear a mask, social distance. If you're on a key test or a key top, get vaccinated and help with the program. If you're not here yet and you want to come, hang in there. I know I've been saying this for a long time, but that's just the way things go right now. Nobody knows really what's happening. These are all projections about what's going to happen in the next month if we're going to get this big spike. We know right now, in reality, Java is in a bad situation, and our numbers are trending up again, and that's not good for us. And we're getting increased numbers from people coming in from outside of Bali, domestic travelers, domestic tourists. And so the situation's not real good. I hate to be kind of depressing, but it's been a week of depressing news, unfortunately. So, hang in. And the good thing here is, I guess, for me, is the weather is nice, with the exception of that big wind before. Weather is great. People are hanging in, but they're hanging in. So that's the situation, right? Nobody really knows. People that make predictions, they're making predictions. The epidemiologists, the scientists are making predictions, they're basing it on science. People that are making predictions about Bali is going to open in like 2 weeks, 3 weeks, those are social media warriors. Most of them don't know what they're talking about. They're just guessing. And I'm not going to guess at this point. Could be July, could be August, could be September, could be December. Not clear. So hang in, stay safe, thanks for viewing. I hope next week we got a lot better news. Be kind to someone today. Take care. See you next time.